Now, this is a table that's from your book, and it would serve you well to commit it to memory. While it actually may not be all that hard to memorize this one table, let's talk about the concepts of ECG localization and why we see what we do see on an ECG during a STEMI. First off, we need to know how the leads are arranged on the patient. Here are a few great images to represent lead placement. On this first image here, you can see our precordial leads. And these are leads V1 through V6. And on our second image here, you can see a few of our limb leads. And if you remember back to Einthoven's triangle, this includes leads 1, 2, and 3, as well as AVR, AVL, and AVF. Now, knowing exactly how the limb lead tracings are constructed based off the leads placed in this image is some good info to know, but we're not going to discuss that any further here. Now, what we do need to know is that each individual lead corresponds to a particular location on the heart, and we can use the changes within that lead to know which artery is affected during your MI. So we'll start off here looking at the precordial leads, which are again V1 through V6. Here you can see how these leads correlate to the physical heart sitting inside the chest. This image also shows us normal R-wave progression, which is great to know, but not the purpose of this image. So generally speaking, V1 through V4 are picking up anterior depolarization activity. So any changes that you see on an ECG in V1 through V4, be thinking about the left anterior descending artery. And as you can see from our diagram here, V1 and V2 are in rather close proximity to the anterior septum. And which coronary artery supplies 2/3 of the anterior interventricular septum? There you go, it's the septal branches of the left anterior descending artery. So this is why an infarct in the septal perforating branches of the LAD will show up as ST changes in V1 and V2. Now, do you remember what supplies the anterior lateral wall of the left ventricle? There you go, that's also going to be the LAD as well as the left circumflex. So in this case, if you saw ST changes in V5 and V6, you'd be expecting anterior lateral wall ischemia, which is supplied by the LAD and the left circumflex. Alright, now let's take a look at our limb leads. We're going to draw them out on the image of the heart we have here, so we know how they're oriented on the heart itself. So let's start off by looking at the inferior leads that are sitting below the left ventricle. These are leads AVF, V3, and V2. Now all of these leads are examining what's going on with the heart from the inferior side. So they're kind of like a camera that's sitting on your shoes and looking up towards your heart. And do you remember which artery supplies the inferior aspect of the heart? There you go, it's the right coronary artery. So if you had an inferior wall myocardial infarction, you'd expect to see ECG changes within leads 2, 3, and AVF. Now what about leads 1 and AVL? Well, these are predominantly on the left side of the heart, and they're great at examining the lateral wall of the left ventricle. And do you remember which arteries supply this area again? There you go, the left circumflex artery, and to a lesser extent, the left anterior descending artery. So if you had an acute blockage within your left circumflex artery, you'd expect to see changes within leads 1 and AVL. Now, on a side note here, an infarct of the posterior descending artery can be seen as ST segment depressions with tall R waves in V1 through V3. There's also 3 additional leads that are sometimes placed, and these are V7, V8, and V9. And these leads are placed from the posterior axillary line to the left spinal border. And these give us a better view of the posterior side of the heart because they're on the back of the patient. And an infarct in the PDA would show up as ST elevations in these leads. Alright, so now that we know where to find the ST elevations during an MI, let's try to tie it all together by actually looking at an ECG. Here you can see your precordial leads, which are V1 through V6, as well as your limb leads, which are leads 1, 2, and 3, as well as AVR, AVL, and AVF. Let's start by looking at leads 1 and AVL. If you see ST elevations here, you should be thinking the left circumflex artery, or the lateral portion of the heart. And now for leads 2, 3, and AVF, you should be thinking about the right coronary artery, or the inferior portion of the heart. For V1 through V4, you need to be thinking about the left anterior descending artery and the anterior portions of the heart. And for V5 and V6, you also need to be thinking about the LAD as well as the left circumflex for the anterior lateral portions of the heart. Alright, well that's going to wrap up ECG localization of STEMI. I'll see you in the next video.